What's going on, everyone? Happy Thursday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Thursday edition of the Pandemic Update for Thursday, April 18th, 2024. If you're new to my channel, this is where we do the daily Pandemic Update on all things COVID and any other virus that could be a health threat to you. Want to keep yourself safe? Subscribe to the channel down below. I promise to help keep you safe and informed. Want to keep others safe and informed? Share this video with anyone you know, social media, Reddit, anyone, anywhere. Like the content you see here, give it a thumbs up. And of course, if you have a comment, leave a comment down below. All right, before we start today, which we do have quite a few things to look at, I do have one quick message for you today. Today happens to be my birthday. I turned 34 years old today. I'm not ashamed to admit what my age is, but many years ago, I never thought at 34 years old two things. One, never thought I would be doing a YouTube channel to help people keep people safe from COVID. And two, I never thought we would be in a global pandemic where you still have to mask, you still have to do all these protections just to stay safe to live another year. Here we are. 2024. I know this pandemic started back in 2020. Back in 2020 at this time, we were still questioning, wow, how long is this going to go on? This is getting pretty serious. I mean, some people were chomping at the bit to reopen, while others, like myself included, were saying, oh boy, this is not looking good. How long are we going to be dealing with this? Well, here we are. I turned 34 today, and guess what? COVID is still a thing. Did not think that would be the case 4 years ago, but here we are. All right, let's get into today's update. Severe COVID in older adults may be due to greater viral load and weaker immune response. And then you come down here, and, well, this is not a good bit of information. Adults older than 75 are 140 times more likely to die, meaning die of COVID. Yikes, that's not good. You want to read fully about this? I tweeted it out, or retweeted it. Yeah, you can see that. And how about this? This is not good. This was something that was trending on Twitter, and I thought we would go to that page, and I thought we would read the excerpt. This has to do with H5N1, which we've been talking about a lot lately. WHO stands for World Health Organization. The WHO sounds alarms. Bird flu's extraordinary high risk. This is not good. Let's actually read a little bit of this. The World Health Organization, the WHO, has raised alarm over the spread of the H5N1 bird flu, expressing enormous concern about its potential to jump from birds to humans. The H5N1 variant has an extraordinary high mortality rate, with a reported case fatality rate of 52% since 2003. 889 cases and 463 deaths have been reported worldwide from 23 countries, with no evidence of human-to-human transmission so far. The WHO's chief scientist highlighted the rapid spread across various species, including mammals, as a cause for concern. Experts urge close monitoring and caution, emphasizing the importance of understanding the risk and taking necessary precautions to prevent the spread of the virus. Wow, that is pretty serious. As of right now, it's still just popping up here and there. We're finding it in more animals. We found it in cows this year. That's the first time. Am I personally saying it's going to jump and do human-to-human transmission this year? No, that's not what I'm trying to drive across, but I'm trying to alert you that, hey, the threat is out there. And unfortunately, with how laid back we are with everything, we see what's going on with the COVID pandemic. We're letting COVID do whatever the heck COVID wants to do. And the point I'm trying to make is, should this ever happen, be prepared. You want to be one step ahead of the game, because the potential's there. It may not happen today. It may not happen tomorrow. Maybe several years from now. But the threat is there, and the threat is real, and it's something we have to continue to monitor. Now moving on to this, 86 more measles cases in the last week, with clusters in 4 places, and this has to do with the UK. Specifically, I believe this is in England. And moving on to Ireland now. Ireland reports 3 more cases confirmed, bringing the total number this year to 16 for measles. Now taking a look at what is going on in Hawaii in the past week. Statewide COVID-19 Counts. New cases, 184. Total cases, this is their total number, 418,553. New fatalities. Hawaii did add 2 deaths in the past week. Total fatalities, they have 2,169. Their daily case average is 22. And the positivity rate is 3.3%. So, yes, cases. They're still having cases of COVID. At a good amount of cases, 184. Actually, that's not a huge number, but for Hawaii, hey, 184 cases added. That's something to be concerned about. Not much to show you on the website today, although let's come down here. We did add some new things in chronic wasting disease. Yes, chronic wasting disease. There's been some more cases found in North Carolina, and Pea Ridge National Military Park reports its first case of chronic wasting disease. Hey, it continues to spread, and I'm going to be adding more stuff to this because it's really been starting to hit the news lately. There's been some rumor going around about a study that maybe 2 humans back either last year or the year before died of it. I can't fully confirm that, or else I would show you the study. It's been conflicting. One website goes to a broken link, but it's only a matter of time. There's a lot of hunters out there, and a lot of Pennsylvania included. There's a lot of states that just do not take chronic wasting seriously. They take their deer in to be butchered, and it may be a chronic wasting disease management area. And there's a lot of butcher shops are saying, "Oh yeah, we're not concerned about that. Here, we'll butcher up your deer. It'll be ready on Saturday." Like, really? You need to take this serious. So, because of that, I mean, it really is only a matter of time until it goes to humans. I hope it never does, but we'll see. It's only a matter of time until it could infect a human. All right, taking a look at air quality data today, and we will see that air quality across the country is rather mixed. We got problems in California still, the usual spots. Not bad in the Northwest, not bad in the Northern Plains, but then you come down to the Mid-South. Texas, there's a lot of orange and yellow today. Southeast, a lot of yellow. Some yellow in the Mid-Atlantic today. Also seeing some yellow in Indiana, Illinois, Missouri, portions of the Great Lakes. The far northeast up in New England is not doing too bad today. There is the threat of severe weather today across portions of Illinois, Indiana, Kentucky, Missouri. Be mindful. Damaging wind, hail, even an isolated tornado. Just want to make you weather aware because that is something that I am very big on. I like to advocate for is weather awareness. All right, taking a look at this map, and you're probably going, "What's this? Haven't seen this year." That's right, we have not shown this for a while, and it's time we do. It's the good old pollen map, and we can see there's a lot of places in the red. If you're in Virginia, North Carolina, South Carolina, Georgia, Tennessee, Kentucky, the Great Lakes, back across the I-40 corridor. Yes, there's a lot of places that are in the high at this point for pollen. There are places, even as we head up into the Pacific Northwest, we do see some reds. Montana and down in Wyoming, you're not doing too bad right now, but just to your east, take a look at that. There's some red in Minnesota, the Dakotas, Great Lakes. It's a lot of places right now that are starting to deal with high pollen levels, which is normal for this time of year as we head into spring. All right, moving on. 750 EMS incidents in Philadelphia yesterday, and as of just before starting this video, oh wow, it's actually gotten even busier. Good Lord. There's a lot of calls right now in Montgomery County, Pennsylvania, and as of just a few moments ago, Chester County was going to be the same. We got hemorrhaging, seizures, respiratory, cardiac emergency, vehicle accident, head injury, on and on. A lot of cardiac emergency calls. Before I was recording here, there were at least 4 or 5 respiratory emergency calls. I'm afraid to look at Chester County. Yeah, it continues. Heart problems, cardiac arrest, heart problems, hemorrhaging, respiratory difficulty, injured person, respiratory difficulty again, unresponsive person, sick person, injured person, unresponsive person again, another respiratory call, another heart problems call, another sick person. It is really busy right now. It sounds like it's going to be a night where I'm listening to dispatch. Yeah, fun thing to do on one's birthday. Hey, it amuses me, and, well, yeah, here we are in a pandemic that does not want to end, and I get it. Some of those calls are obviously not pandemic related, but it really. I've said this before, I'll say it again. I've been following CAS for years. I also do a traffic Twitter, which I just resurrected several weeks ago, where I started tweeting traffic again. I can tell you, back in the day when I used to do that, pre-COVID, There were never this many ambulance calls because I was always looking at these two cats, and it was just never this busy. This is insane, especially not at this time at night. 5:30 at night. The busiest time of the day is usually between about 11 o'clock and 3 o'clock. And here we are, 5 o'clock at night. All right, Walgreens today. The national positivity rate is 13%. Prior week, 13.5%. Difference of down 0.5%. Total test is 4,875 versus 5,867. So testing is down. I wanted to see if we could see anything from Alaska and Hawaii today. No, we can't. Okay, so can't show that to you, but we can take a look at Oklahoma. What's going on in Oklahoma? So Oklahoma, the number of total tests, it's up 62 versus 56, as is the positivity rate, 19.4% versus 14.3%. That is up by 5.1%. That is not good to see. And we just want to quickly take a look at one more state, Connecticut, which, by the way, we will have some state data from Connecticut today. The positivity trend in Connecticut is 7.7%. Prior week was 7.1%. Difference of up 0.5%. Total tests, 39 versus 42. Quickly taking a look today, we're going to just do 2 wastewater sites if we can. Sometimes wastewater scan does present us problems. And let's go to nationwide. Here we go. Wastewater scan is working today. Let's go down to Washington, D.C. Let's see what's going on there right now. We can see COVID levels. They're dropping at this time. RSV, a little bit of a rise. Influenza A is dropping. Influenza B is dropping. HMPV, not much of an issue. Norovirus, no issues. No Mpox. And hepatitis A, at this time, just a couple detections of that. Let's do one more wastewater site, and I reckon we should head out to the West Coast, if we can. Yes, it is working. Let's go to Las Vegas, shall we? What is going on in Viva Las Vegas? Well, if you look really close, you can see there is a slight rise for COVID at this time. RSV is low at this time, not much in the way of issues there. Influenza A is dropping, Influenza B is rising, just slightly. It was, now it's starting to drop. Norovirus is dropping at this time. And we come down here to, let's see, Mpox, no issues. Hepatitis A, not much in the way of issues at this time. Alrighty, moving on now. We're just going to take a look at one piece of CDC data. That is the latest variants. You need to be informed with this. JN.1, 83.7%. JN.1.13 at 9.1%. JN 1.18, 2.5%, and JN 1.16 at 2.4%. All right, New Jersey and New York. I actually have to refresh these numbers. Apologies in advance. Let's see what's going on in New Jersey's hospitalizations today. You're seeing this the same time as me. Here we go. This actually seems a little bit higher today. Looks like they corrected it slightly higher in New Jersey today. 206 hospitalizations, 67 out of 70 hospitals reporting, 10 people on a ventilator, 27 people in the ICU. Discharges, 20 people were discharged. New York State, drum roll please. Let's see what New York State's numbers are today. Okay, a bit higher than yesterday. 606 new cases. Again, not terribly concerning, but also keep in mind, does not include these guys right here, the at-home test. And New York State hospitalizations. Let's see what they look like for today. So zooming this in, drum roll please. Here we go. New York State hospitalizations. Wow, they are down a little bit once again. Looks like actually, no, I want to correct myself here. It looks to me, what's going on here? Let me refresh this again. Looks to me like that is not showing today's data. It says data as of April 10th. Let's go back for a second. Yeah, New York State's data is not today. Testing data as of April 8th. So forget anything I said about New York State. This is all not up-to-date data. I don't know what this deal is all about, and I'm not seeing any notes down here telling us as to why they are showing data that is over a week old. Okay, moving on. We have more states to take a look at. Colorado for this week. Colorado currently hospitalized is at 77. So that number did drop. Their cases went up ever so slightly, 673 versus 42. All right, moving on now. We actually have to move to yet another browser. Well, why is that? Because we need to take a look at what is going on in some other states. In Connecticut this week, 184 influenza cases, just 66 COVID cases so far. That's a really good number, but again, remember, does not include these at-home tests. RSV, just 12 cases this week. The previous week, they did total 324 cases, so I suspect that 66. It's going to go a good bit higher by the end of the week. Chicago this week, hospitalizations are down. The current daily average is 7.71. Hospital bed use is down 0.9%. Emergency room visits 0.5%. Of the visits are for COVID, and that's going down. Laboratory confirmed cases, daily average is 40. That's going down. Deaths, daily average is just 0.14. That's not many. And there were 2,268 vaccinations. Let's see what is going on in Massachusetts. I have to refresh this because they still did not update as of the time I started this. They should now. I think it's 5 o'clock they're supposed to come in. Okay, so this is good. Percent of emergency department visits in Massachusetts that are for acute respiratory disease, it's down from 12.1% to 11.5%. Influenza severity is moderate. COVID-19 emergency department visit level is minimal, and COVID-19 hospital admission level is low. All right, one last state to take a look at. Washington. Good news all around. Percent of emergency department visits for COVID, down 17%. Also down 17% for influenza. Percent of hospital admissions is down 22%. Average number of ICU beds occupied, it's less than 10 for COVID. It's less than 10% for influenza at this time as well. So, yes, things are doing really well here. And influenza hospital admissions, look at that. It unchanged, 0%. There's not that many ongoing right now. Things are trending better. Alrighty, folks, that does it for today's pandemic update. We will have another pandemic update again tomorrow where we will have the weekly CDC data. So it'll be interesting to see what happens there. I'm assuming we'll probably get BioBot data at that point. So I will see you all again tomorrow. If you like this video, give it a thumbs up. If you want to see more content like this, subscribe to my channel down below. Hit that share button to help keep people safe, keep more people informed. If you got any comments on anything you saw today, leave me a comment down below. I will see you all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Thursday evening. And thanks for watching. Take care.